Hi, everyone. My name is John Faulkner. I'm your host of the Smarter Systems Better Care podcast, and I'm here today with Dr. Cristin Dickerson. She's the founder of Green Imaging, a nationally recognized radiologist dedicated to making high-quality medical imaging affordable and transparent for all. Thank you for joining us today, Dr. Dickerson.
Excited to be here.
Excellent. Well, let's go ahead and get started. To give our listeners some context, what's the core focus of your business today? And how do you serve your clients?
I started Green Imaging about 15 years ago to solve a problem in my community, which was there wasn't affordable imaging. The chain of imaging centers that was operating in network, that was affordable to people on health plans, was purchased by a hospital system, and overnight the prices tripled. And so the other imaging centers, the ones I was reading for, were operating out of network because they were being paid so little in network, and there just wasn't a good solution. So people would call from the hospital and say, "Do I really have to pay $3,000 for this MRI?" And the answer was yes, unfortunately. Travelocity and a lot of cost savings models were emerging at that point in time, and so I got the idea of trying to buy the excess capacity instead of just opening another imaging center where I would have the same problem. Buying the excess capacity at facilities where we were reading and interpreting the studies and passing savings along to patients seemed like a logical solution. And it turns out that because radiologists are not the referring physician, some other doctor has recommended that the patient get this exam. It complies with the Stark laws for radiologists to have that kind of relationship with an imaging center. And so I was able to do that, kind of created proof of concept for a few years by doing that business to consumer, offering it to self-pay patients. But I had run a self-funded healthcare plan in a previous in kind of career engagement, and I knew this could be a wonderful thing for employers to save cost. And so that has come to fruition, and we're really, we're working with about 3 million people who have this health plan nationally now.
That's amazing. So how long have you been in business?
Green Imaging has been around almost 13 to 15 years. We kind of started in a very nascent way, just trying this out. I would say really since in 2017, we gave up all of our insurance plans and really went to this direct contracting self-pay model. So we've been around.
Where do you spend the most energy kind of driving growth right now? Because you've been operating for almost 15 years. Where do you spending most of your time during the day?
It's really having to educate people. I speak nationally on healthcare cost containment and on what the problems are in the healthcare system. It's really people coming to understand that they have choices and they don't have to use United Healthcare. And I actually wrote a book last year called Aligned, and about the ethical alignment between doctors and patients and employers, and how important it is for us to be ethically aligned in how we acquire healthcare.
Yeah, that's excellent. I'll have to check that out later. So thank you for sharing that book. And then what kind of zooming out, looking at the industry, what's one shift in your industry that most leaders aren't paying enough attention to in the space around radiology?
Well, I think larger employers are doing this already. They're starting to keep their, what we call the BUCA plans, Blue Cross Blue Shield, United, Cigna, Aetna plans. They're keeping those plans, but they are carving out pieces where they know they can save money or provide better access for their members. And so I think at the Dallas Business Group on Health meeting last Christmas, the average larger employer there had 11 solutions bolted on. And I don't
Wow.
think enough smaller employers are paying attention to that and seeing how that's done. And then I think also, I don't think people understand how many hidden fees there are. So when a big employer looks at Green Imaging and I say I can save them, 80% on their imaging spend, they just think that 80%. They don't think that if a patient doesn't go down the hall at the hospital and instead comes to Green Imaging, so they have a $400 MRI instead of a $3,500 MRI, they haven't met their deductible with just one imaging study, whereafter the plan is picking up all the rest of the care the rest of the year. There's a lot of short-sightedness there. They also don't realize that they're being charged a lot of things by these health plans that really don't serve their interest. I'll give you an example. Pre-auth. Now, people go and get a pre-auth, and, I think Cigna's proud that they turned down about 40% of those. I think with United Healthcare, it's been 50%. But what happens is the person goes and gets the 6 weeks of physical therapy, which costs a lot more than the $400 MRI would have. And then the pre-op process starts again, they get charged. The employer gets charged twice for an authorization process. And then usually it happens the second time. Very often these are then authorized. So they're really not saving anything. They're really just driving up the cost of care.
Yeah, and like kind of curious too, like in that decision-making process with your potential clients that are looking into you as a solution, when does that light bulb come on where they're like, hey, I finally get what you're talking about. Like I understand. Let's do it.
It takes a lot of time and energy, and that's where my energy goes, is in, I'm on LinkedIn a lot, and I'm showing how the broken system works. I'm showing I'm showing EOBs that we get from the insurance company that make no sense, where it's they've discounted our cost, so say our price is 400, they've discounted the exam 425 and it says minus 25. What does that mean? I have to pay them?
Exactly.
It
Yeah.
makes I posted.
Yeah. I actually saw that. I saw you post that. Yep.
Yeah, this sting system is just so broken that I think people need to wrap their head around that. And so that's what I spend a lot of my time doing. On the other hand, I'm spending a lot of time right now just trying to absorb the growth that we have for next year, because there's definitely, I think the United Healthcare, the CEO's murder was a turning point for our country. I think it started to be okay to speak out about what was going on. I also think cost and the fact that we're going to be, we've got probably tremendous inflation coming, and people are still, so much of what could be wage increases are still going to covering their health care. And then it's covering a health plan that they really can't, they're putting all this money into premiums for this health plan, and they don't have anything left over to pay for care.
Yeah, that's a shame. I can definitely see how you're fulfilling that gap is like you've been around for a while, but like it sounds like there's been like events that have happened out in, the real world that have made people like you said, question the system more and but not only question it, but take action for that next step, right? Is essentially what you're saying. So yeah, that makes sense for sure. And then how have you adapted, with these changes? Like what happens to your business if like you ignore the shifts? Like what happens that you've seen?
Well, I mean, I would say, we have to be resilient. And my company is totally bootstrapped. We have zero debt. I mean, I didn't do this I did this as a side gig for a long time. And by being a radiologist, basically subsidized it so we could move forward. So we're super, we don't do anything to excess financially. Everything we do is to contain costs and to be able to pass that cost containment on. And I think that makes us very resilient. When the pandemic hit, both Texas and Florida, which were where most of our covered lives were limited to essential imaging, whatever that is. It was just really kind of only emergency. And so our volume dropped overall about 50%. And so we
Wow,
really
that's pretty significant.
decision. Another radiologist and I are partners in this company, and we just decided we weren't going to lay anybody off. And so we put people on projects. We didn't take home money. We just knuckled down and did what we needed to do. And so I think, that's the kind of thing. And then, again, there was a rebound after that where people had not imaging, and we had lots of cancers being diagnosed at later stages, and it was fairly chaotic post-pandemic as well. So those things, I think that kind of small business mentality that you continue to carry with you, even as you become a larger business, I think makes you stronger and more resilient.
Yeah, absolutely. And trying to persist through those very difficult times, especially like the pandemic, which is, I'm sure, surreal for yourself and for everyone that went through that time. So, yeah, that makes sense.
We
Absolutely.
had an employee actually whose husband was one of the first placed on a ventilator in the Texas Medical Center,
Wow.
riding
Yeah.
um, that terrible event with her. I mean, he was a young, 40-year-old man with no risk factors and just got terribly sick, and he survived. But, they've had a lot of um, repercussions from that as a family. And, supporting her has been, something that we feel strongly we need to do.
Yeah. It sounds like you really are empathetic to your employees and your staff and really try to work with them to get them through not only professionally, but personally as well.
Yeah, and that's hard to do because not everybody wants their boss involved in it. Some people do want their boss involved in it. I get questions every day from my employees, but others, don't realize that their boss, if they have employer-funded healthcare plan, their boss is in their healthcare. And to underwrite health plans, they're going down to the buying your credit history. I mean, it's not your employer himself, but the companies he's using to do actuarial analyses are looking at your spending patterns. They know where you spend your money, and that's very indicative of what your health is like. And lots
Yeah,
of fast
absolutely.
food there, and that's going to score you down. So it's very interesting to see how that's happened. People don't realize, if you want to get healthcare from your employer, they're involved in your healthcare.
Yeah. And I've heard of that happen as well, especially in larger health systems are very involved. They incentivize you too as an employee to make sure you're meeting certain milestones, getting blood tests done. I'm sure these are not new things that you've heard about, but those are things that I've seen anecdotally throughout this healthcare system that is out there. Yeah, absolutely. And then, getting to like a systems and efficiency gaps on the podcast, like where do you like when you look at operations day to day in your business, like where do you things feel like clunky or like slower than you like? Are there things that come to mind as you're working with your clients or your operations that you're trying to make better?
Yeah, I think it's the we try to honor how patients want to communicate. For my mom, she wants to pick up the phone and talk to somebody.
Talk to
I want
somebody. Yeah.
And with me, everything should be done by email. My son wants to text everything. So, we ultimately, most of our patients text at some point in the encounter, but we really want to meet. And then, we have the old system where doctors are still sending an order by fax out of their EMR, or, we get things on prescription pads from doctors still. And so trying to ingest all of that information into one system, translate the flat data into electronic data we've spent about 5 years really working hard at that so that we can streamline things for the patient. Even our web chat, which really very often now when I do web chat, I know it's AI, at least in the front. Anything that's patient facing, we keep people involved because we feel like when people, no matter if it's just a screening mammogram, that's a stressful event.
Yeah,
And when
absolutely.
come to us, they're under healthcare stress. So we want real people addressing them, and hopefully in their native language as well. I think that's very important culturally. But back office, we're using AI, we're using bots, and we have nearsight and farsight teams, involved in the back office to try to streamline operations. But that front line, I don't think you can get away from the people aspect of healthcare,
Yeah.
and I think why we're doing better than the platforms and the apps. I think that's why green imaging is outperforming those. It's the people.
Yeah, absolutely. There's always a person component to AI, especially to act like kind of like not a barrier, but like a checkpoint, if you will, to approve the message and, make sure that it makes sense to people. And you get that feeling that you're looking for as a patient because, like you said, you don't want an AI, person to contact you over an imaging study or something. That's not the best way to follow through on that. You still need a person to contact the patient and go from there, right? So absolutely. And then it sounds like too, like you have like a pretty good process around like following up with patients as well with their care. Is that done through like patient portal messages or how do you best communicate with patients? Is it on personal preference? What works best?
I find portals to be prohibitive. I mean, I don't want to, even as a doctor, I'm asked to sign into this portal or that portal to get information I need or to
Yeah.
pick up an order. And I think everybody is portaled out and apped out. And so we use secure messaging to communicate with our imaging facilities, to communicate with patients if they'll accept it. Now, not every patient wants to or has access to that. And some of our patients are older and just are not technologically savvy. But wherever we can, we do use secure messaging. We find that to be more nimble, shall we say. And, we can send a link to images. We can send a link to reports. We do try to do, it's very interesting because when people try to access, there's still a problem. The historic way that people got their images was on a CD or a DVD.
Yeah, I remember that. Yeah. It still happens.
Yeah, some hospital systems will only take patients' prior images on a CD or DVD. It's hard to figure out how to get those onto a CD or DVD these days. I mean, we're challenged with that. So, we had a solution where it was a national chain that would translate those for us, and they went away, too cumbersome for them. So it's really a problem. There are QR codes now that are transmitting, where you can transmit images. There's some new technologies, but they're not ubiquitous. Nuance Power Share is one that a lot of the hospital systems use. I mean, we've implemented those wherever we can to be as nimble as we can in the image sharing and report sharing space. But it's still a problem, and it's again one of those problems that somebody's making money off the old way of doing it, which is contained EMR. Epic, has a monopoly there, and when that's the case, it makes it hard to create change. And we're doing the best we can with that.
Yeah, and it sounds like you're making a massive impact in that space as well. Not only on cost, but also improving your own internal processes as well. So really making things cleaner for the patient. Looks like you've performed a lot of outreach to make that happen. And even try to solve solutions like the physical disc or, some other method that's very manual and tedious. So yeah, I can see, why your efforts would be appealing to your clients. So that makes sense for sure. And like, what's working really well that you never want to lose right now? Like, what's something that's like, you're just like super successful and you just can't live without? Is there anything like that in your business?
I don't know that it's that as much as I think there's some great trends happening right now
Yeah.
that make it easier for us to, so we've gone from our average employer being, a couple of hundred employees to now it's in the thousands. And I don't want to, as an employer of, 43 US based people, I don't want to exclude smaller employers, but it's hard to justify. It takes almost as long or sometimes longer to implement a small group as it does a large group. And so how do we keep from alienating those smaller groups? And that's been one of the challenges for me. And what I'm loving is that we've got a number of people putting together health plans, because what's been happening in kind of the ecosystem, the tribe that we're working in, is that people have been putting solutions in place. That still doesn't, so you've got a Blue Cross Blue Shield plan, but it says for imaging, call green imaging, medical management, authorization of a surgery, call such and such number. That doesn't feel very cohesive to plan members. And in fact, really even with the Blue Cross Blue Shield card, you're going to get some of this. It's going to be subsidiary companies that are doing that. But in an effort to really combine things clinically, have access to the same data, have the same solutions working together so that they know how to operate and exchange information. Us get if there's a under surgery solution, us getting the images and reports across to them easily. What I'm seeing is people creating smaller health plans, not the big United Healthcare plans, but Josh Butler is, out of Amarillo is doing High Plains Health. Santa Benefits out of Austin has, some smaller health plans, and they're putting the same solutions in place and making it easy for smaller employers to implement a different kind of healthcare. And I'm really excited about that. Daniel Corliss has A-Frame Health. There are just a lot of these emerging that I think are going to make this alternative market more attractive, especially for those smaller employers. I think larger employers need that more customized. They need, green imaging for this. They may need, pet sitting, and they may need, because they've got a population, they may need fertility coverage. They're going to customize it. Whereas if you're just a 50 employer and you've got to get health care affordably for your members and make sure that they can access that care, but they're not going to be priced out of, having money left to pay for care by the time they pay that premium. I think a lot of these health plans are really changing the game.
Yeah, it sounds like it too. And it sounds like what you're talking about as well is like you can still have like the big healthcare plan, but also have these other, like yourself, is like green imaging solution. And then these other individuals too, they have their own, smaller solutions for healthcare. So then you're kind of getting like the full package, if you will. Right. Yeah, that makes sense.
And it can be even that an employer offers a Blue Cross Blue Shield plan, but to the people who are not currently buying the Blue Cross Blue Shield plan because they can't afford it, they offer one of these more affordable options that have these zero out-of-pocket solutions. If you use green imaging, no copay, no deductible, it's zero out of pocket. Having options like that for even a larger employer is, I think, a game changer.
Oh, absolutely. And like, and in your business too, kind of getting a bigger picture again, what is success going to look like for you in the next 6 to 12 months? Like, what's your vision for your company?
I think right now it's absorbing the lives we have in the pipeline. What I never want to do is get so big that we can't take great care of people. So that's my challenge right now, is absorbing the growth we have, but keeping it real. If you look at our Google reviews, they call out our concierge by name. I never want to lose that. I want to keep that feeling of connectedness in healthcare. And I think the other thing that's missing from healthcare right now is trust. And I want to help restore that trust that we can do this right. We can do this affordably and take great care of you, and you're going to get the same or better outcomes.
Yeah, absolutely. And I really appreciate your time today on the podcast. It's been a great conversation. How can people connect with you? I know I'm aware of LinkedIn, but what about other places people can find you?
Our website is Green Imaging, www.greenimaging.net. If you go .com, you're going to end up in Canada.
Canada. That's a good call out.
Yeah, and we've got a web chat where you can get pricing for an exam. We've got all kinds of emails listed and then we've got lots of videos posted. If you want to learn more about this kind of alternative healthcare market, I would say go there because we have a lot of educational pieces.
Excellent. Well, thank you for your time today, and I really appreciate the conversation. Have a wonderful day.
Thanks.